Hi, welcome back to our Dental Spotlight. I'm Dr. Sharma.
And I'm Renee.
Today we'll be talking about toothbrushes. So I know, Renee, there are tons of toothbrushes in the market as well. So let's talk something about what we know about the toothbrushes.
Okay, so first thing you want to make sure you're using a soft toothbrush or extra soft, and it should say right on the top of the package, which it is.
And then, so why don't we use the hard toothbrushes?
You don't want to use a hard toothbrush because it can cause tissue damage. It can abrade the gums and cause damage to the tooth, which we call recession, and it can cause caving in the teeth.
Yeah, which is not good.
Right.
Then we have different sizes for...
We do. Yeah. You want to make sure that you're using the right size. These are actually kid sizes. This one is age 5 to 7, and it doesn't have to be exact. You know, if your kid is 8, this still might fit them. But if you're using a toothbrush that is too large, you're not going to be able to get it all the way in the back, which is tough to do on its own.
I know. So we also recommend the electric toothbrushes for our patients.
Yes. Yep.
Talk about that.
An electric toothbrush is ideal. Studies show that it removes 70% more plaque than the manual, which we know plaque is one of the main causes of gum disease, so you want to make sure you're brushing effectively. So if you can get an electric toothbrush, we recommend that. So Oral-B is a good brand to get. You can get this in the office or at the grocery store. You want to make sure that you get a soft head. But really, if you can't get Oral-B, any brand is going to be better than a manual. So any electric toothbrush you find will be better than a manual, more effective at plaque removal.
We do tell our patients that they need to brush their teeth for 2 minutes. Can you talk more about this?
Sure. Okay, so like Dr. Sharma said, you want to make sure you're brushing for 2 minutes twice a day. Some studies show the average person brushes their teeth for 30 seconds, so we don't want to do that. You can set a timer if necessary. So to start, you want to take your brush and put it at a 45-degree angle right along the gum line. Plaque collects right here where the tooth meets the gum, so you want to make sure you're not missing that when you brush. So right at a 45-degree angle with short back and forth strokes all along the tooth surfaces. You don't want to scrub. That can cause the recession and the damage to the teeth. Okay, so you want to go all the way around, short back and forth strokes, okay, all the way on the bottom. You want to get the inside. The lower molars all the way in the back is a common spot to miss. I'm sure you've noticed that people get a lot of plaque buildup. So you want to make sure your tongue gets out of the way and you're reaching all the way back there. And don't forget the biting surfaces of the teeth. Okay, when you get to the front, you're going to turn your toothbrush up and down. Go this way. Okay, same on the top. You also don't want to forget to brush your tongue, or a tongue scraper is ideal, but that's going to help keep bacteria off your tongue and freshen your breath.
Absolutely.
Yep.
Yeah. So I know for a fact that if your toothbrush looks something like this, it needs to be tossed.
Yes, which brings me to my next point. You want to make sure you replace your toothbrush every 3 to 4 months.
Absolutely.
Yep.
And make sure you can have your cleanings every 6 months.
Yep.
That's very, very important. Well, thank you for watching this segment. See you next time.